Well, we're here in Uganda with Afa, and you've been looking after us, so thank you very much for that.
You're welcome.
I would like to do a bit of an update on the COVID situation in Africa. There was lots of uncertainties at the beginning. But let's start off with the situation now, today. Where are we? Getting near the middle of September.
Yeah. So when you look at the COVID-19 situation in Uganda, the situation is really calm. It's like we are returning to the norm where we were 2 to 3 years ago before the pandemic started. In Uganda, people are living normally and they are no longer worried about COVID-19 like it used to be. And when you look at the Ministry of Health, the measures were even relaxed a bit, and they are not updating daily like they used to.
When did they last update?
When you check on the website, you find that they last updated in 1st August. Yeah.
So 6 weeks ago nearly.
Yeah, 6 weeks ago. Yeah. And they have not yet updated. Though their website and Twitter handle, they are active, but they are updating things that are of public concern at the moment. So it seems when you look at that information and you see in the public, when you move, I believe when we came on the way, you were able to see people in the markets, how people are moving. Generally, you barely get someone with a mask.
No.
It's like everything
completely
is very normal. Yeah, it's
crowded
normal.
buses, crowded minibuses.
Yes.
Our restaurant last night was crowded. So
yes.
Back to normal.
Yeah, back to normal.
But are you're a clinical officer, so are you seeing people getting sick with COVID, or is that finished?
No, I am not actually seeing people with COVID-19 again. Actually, at the regional referral hospital where I'm working, we set up tents for emergency cases for COVID-19 because we wanted to separate them from the general patients. But since the Delta wave ended and Omicron came in, now cases decreased, the tents are even dry. There's nothing there. We barely use them. I think in the past 3 months I've not seen anyone that we've received on the emergency ward.
And this is a big city.
Yeah, it's a big city. Yeah, even if you moved right now to the hospital, you barely get there anyone admitted with COVID-19. And yet it is a center in the region. Yeah, in the whole region of eastern Uganda.
So we can say in eastern Uganda, to all intents and purposes,
yes,
COVID is finished.
Yeah, COVID is no
and
longer
unless something dramatic happens, it's finished.
Yeah, unless something just happens. But if things continue the way they are looking like, we are good to go.
This is really good news.
Yeah.
And presumably this is due to very high vaccination rates in Uganda, is it?
Yeah, no, not really.
No? Oh, really?
Yeah, when you look at the vaccination, because we have the population of around 44 million. But the last data, when I check here, you see that they've given about 24,859,885 doses, but that includes first and second doses. So even if we took that amount, you see that only about 50% or close to 50%.
I've had one dose.
Yeah, have at least a dose.
A dose, yeah.
Yeah, so it has those who have had 2 and 1.
So that means 75% have had no doses.
Yeah, so we see that the majority of the population, they have not received full doses, but we are okay.
So if the reduction in cases is not due to vaccination with Afa, why is it that COVID has essentially gone away now in Uganda?
Yeah, this could be possibly due to cross-immunity from other viral infections because here people are exposed to a lot of infections due to the healthcare system that we have. It's really struggling and people barely reach the hospitals. So people most cases recover naturally, so that helps to build immunity which can cross and fight things like COVID-19 virus. And also when you look at today's situation compared to the time when the Delta variant was there, we used to have a lot of cases, but now they reduced, and this came after Omicron came in. We saw that when Omicron had just come, the cases went a bit high. But in a few weeks, they started dropping, and from that time, they have really been stable. It was just until something like a month and some few weeks ago, when I think we had about BA1, BA2, when cases wanted to come up, but then the situation has gone back. So it could be that there is some sort of herd immunity, because when Omicron came, with the measures that we have, people were not even adhering well. They had opened up the whole country. People had mixed up. So people were infected, but then they were able to develop immunity, which is maybe helping in this case.
And when I look at things around here with the crowding in town and the crowding on the buses,
Yes.
if Omicron came, I think it would spread through the population here really, really quickly.
Yes, yes.
Yeah.
Actually, when Omicron came, during that time when cases went up, almost every person everywhere had some flu-like symptoms. So it is most likely, only that the testing is low,
Very
but it's
low.
most likely that most of the people were infected, because at least everyone in the family, everywhere, they had those symptoms. But because of the population also, the population is very young. In most cases, people are able to go through those things.
So we've got this idea where when Omicron came, everyone in the country got a cold.
Yes.
And you saw this at work.
I saw it.
Yeah, yeah.
I observed it.
Yeah.
I was also at the hospital. I saw it. But because flu for us here, actually, flu is a common thing.
Yeah, just, well, a
When
cold
it's
rather than
a cold
influenza.
is something that is not very
Yeah,
serious.
yeah.
And you can easily go through it without any intervention. So when it came, people were talking, this is COVID, but that's how it went, and it stopped, but it helped. Yeah, after that, everyone felt okay, and from that time up to now, people are okay.
So we've got two possibilities. Omicron arrived in Uganda,
Yes.
and everyone got a rhinovirus cold.
Yes.
Or Omicron arrived in Uganda, and everyone got an Omicron cold.
That could be the issue.
Yeah.
But the thing is that I really tried to follow the situation like closely, because I've really been observing this thing from the beginning. I was so interested, and I was seeing when Omicron came, I could compare the figures on Twitter, website of the Ministry of Health, and then I compare what I'm seeing in the community and in the hospital where I'm working, and you could see people having those flu-like symptoms. But they didn't last for a very long time. It was just there for some few weeks. When it went, we saw cases also started dropping dramatically. Yeah.
But we do know there was some Omicron because of the limited testing did indicate that Omicron was here, so we know it was here.
Yeah, it was here.
Yeah. Isn't the immune system amazing as well, that you can develop this immunity from exposures to one virus, but it's already sensitized to some extent from being exposed to other viruses?
Yes.
And we get this phenomena of, so we get the specific immunity,
Yes.
and we also get the cross immunity.
Non-specific, yes.
Well, the cross immunity is a form of specific immunity. It's not innate,
Yes.
I guess, but
Yes.
it's just, it all combines together. And I think the other thing in Africa may be the parasitic infections,
Yes.
which are way more common,
Yeah, they are very common.
is giving cross immunity to some viral infections as well.
Yes, that is very possible, because even on a medical camp that we are hoping to have on 16th,
We are,
you'll be
yep,
able
yep.
to see some of those cases, and you see sick people. Some things may surprise you, but people live with a lot of diseases.
A lot of comorbidities.
Yeah, comorbidities.
Yeah. And even the fact that people have so many comorbidities and untreated pathologies.
Yes.
Did this mean you saw a lot of deaths in your area?
Yeah, during COVID-19, actually during COVID-19, specifically in my village, no one died of COVID-19.
Zero deaths.
Zero death in COVID-19.
And this is a rural population.
Yeah, that's
It's
a rural population.
Quite a few thousand people.
Yeah, I didn't see anyone.
And old
die
people,
of
people with
COVID-19.
diabetes, people with
Yes.
high blood pressure.
Yeah.
High blood pressure is really common,
Yeah.
isn't it?
Yeah, it is common. But again, when you look at people who died during that time, they were not people who live in the village. Were people who are of actually a certain economic status, more of the rich people who have diabetes and these other serious diseases, cancer, are the ones who succumb to COVID-19 more.
Interesting. So
Yeah.
it's like this is almost a disease of affluence.
Yes.
So the people that could afford a Western lifestyle were those
They are
that
the
suffered
ones
more
who were affected more.
than
Those ones.
the agricultural workers in the village.
The people who are in the fields every day. Actually, when you look now, like when you go to my village, to be honest, you can find there people who never put on a mask at all from the beginning of the pandemic up to this time, but they are still very okay. So even the measures were strict in towns, but people in the villages were living a very normal life. Yeah.
And this is with minimal vaccination.
With minimal vaccination.
Now the Kenyan government, the Ugandan government, well, Kenyan government as well, but the Ugandan government particularly was very worried at the start of the COVID pandemic, and they introduced some quite stringent lockdown measures. So tell us first of all, what were those lockdown measures that they introduced?
Yeah, so during COVID-19, they first of all banned public means of transport, and the people who use even motorcycles could not move.
But can't people just use their own cars?
Like locals?
Can't people just use their own cars?
No, they stopped and they left it for only few government workers.
You've missed that bit. Very few people have their own car, is the point I'm making.
Okay.
Everyone in Uganda gets around by public transport. Everyone.
Most of the people just use the public means of transport. Most of the people.
So basically, the ordinary people just couldn't get around.
So they were limited, and because of that, some people could not move and do some businesses. They closed markets. So people suffered a lot from the effects of the lockdown measures than the COVID-19 itself. We have a state where some people burnt themselves, some people hanged themselves because they were stressed so much because they didn't have what to eat, and the sick people could not move to towns for better medical attention, because now, like in eastern Uganda, we have one regional referral hospital which is in town in Mbale, and someone from my district, Manafa, cannot just foot here.
They can't walk.
Yeah, they can't just walk here. And so it was very difficult for people.
Right. So people outside walking distance of the hospitals had no access to healthcare at all because they don't have their own vehicles.
Yes. And even if they had, they only allowed few government workers, especially the medical personnel. They were the ones who were at least allowed to move, and that's why you saw me moving in the communities and helping those ones who were not able to move during that time.
Which is great. You help some people, but there's millions of people in Uganda.
There are very many.
You can't help them all.
You can't help all of them.
This is really quite tragic, isn't it? So suicides as a result of the intervention measures. So the conclusion is really, I think, a very mild pandemic.
Yes.
Very few deaths.
Yeah, very few deaths.
If I go back to January, February 2020, I was really worried about Africa.
Yeah.
But thankfully,
the situation in town now, it turned out to be very different from what people say. They said Africa should prepare for the worst, but that is not what happened actually. When you look at the total deaths from the beginning of the pandemic up to now, they cannot even go beyond the 4,000.
For 40 million population, 4,000
And
deaths.
when you look at other diseases like malaria, so much. So we gave it a lot of attention. But other diseases are the ones that actually need more attention.
Of course, at the start of this, we didn't know this.
Yeah, we didn't know.
Looking back, it's easy.
Yeah, looking back, it's easy.
We have a saying in medicine in England that the retrospectoscope casts a clear white light. You can always see afterwards.
Afterwards, yes.
So we didn't know, but it looks like many more people have died of malaria because of the lockdown measures than have died of COVID. So lessons learned, but we simply didn't know. But really good news for Africa, very optimistic.
Yeah.
And this isn't just Uganda, is it? This is pretty well everywhere.
Africa. That's the general situation in Africa when you look at the whole statistics. The way the wave was moving, it's like Africa, the situation was the same everywhere. Apart from South Africa, which was a bit deviating, but the rest of the parts of Africa.
South Africa was a little bit towards the Western model.
Yes, yes.
Yeah, but not as much as the United States or the United Kingdom, where it's been very high levels of people dying. Yeah. And I think it's important to say that there's unknowns here. So we know there's a younger demographic. We know there's cross immunity. We know there's a lot of community spread generating immunity. But there's also big things we don't know. So basically, I think I would sit here and say, I don't really know why COVID has been so mild in Africa. I don't think the factors we know about explain everything. So there's a real opportunity for research here. Yeah, a lot has to be found out. So we need to collaborate with Ugandan researchers, Western researchers, and work out why this is. Yes. Because I think there's a real lesson here. Yes. For understanding infectious diseases. Yeah, that could actually help the whole world. Very much so. If they use it somewhere. Yeah, we just need to make the investment and find out. So so let's have more international cooperation with Uganda, and let's. The information is there. We just need to find it out. Yes. Just briefly at the end of this video, Fafa, just tell us a little bit about your project and how it's going. Yeah, so our viewers, thank you very much for always supporting the work here in Uganda. We've been able to reach out to a lot of people, but it has been because of the support that I've been receiving from you, most especially the followers of Dr. John who are following here our work closely. We are working on a lot of things. We have now Land for Food. We are working on the office for the organization, and on the 16th we are going to have a medical camp that is going to host over 3,000 patients, and they will get free testing, free medication, and it is all just because of your generosity. So we thank you very much, and we pray that you continue supporting us, and we cooperate. Maybe in future we may end up with a hospital and we'll be able to treat our people that we usually visit in the communities. Thank you, Fafa, and thank you for watching.